Hi, Deirdre Verbo here for another edition of Let's Talk Seniors, memory care issues, Alzheimer's, dementia, and Parkinson's. Happy to bring you this show Monday through Thursday at 5 o'clock. Please feel free to ask us any questions you would like. We would love to answer them. Uh, as many of you may know, I'm Deirdre Verbo, and I reside in Stamford in Connecticut. Wrote a book. I'm an author and a senior housing specialist. Wrote a book called Home to Home, the step-by-step housing care for seniors. And if you'd like a copy, it's on Amazon, or if you'd like a copy free, I will give you my name and number. Well, I could do that now. I've been giving them away right and left. I'm so happy to give them to whomever would like a copy. So you could either email me or just send me or call me 203-689-7562, and I'm happy to send you a book for free. It talks all about what to do if with your senior or loved one, or if you are the senior, if you'd like to stay in your home, do a reverse mortgage, sell your home, what is appropriate, when to do it, how to do it, and what you need to know. Also have a great workbook that goes with it, and it's all about everything you need to do for senior planning, from your home health care proxy to where the money is, where's your stocks and bonds, what's your IRA, everything your family needs to know, your wishes, your what shall happen to you if you were to break a hip or something were to happen, who's to take care of you, do you want to stay home or go somewhere? So just planning so you can know what's happening, and your family will also know what's happening. So as a senior housing specialist, two things. I buy and renovate homes. I flip homes, and all over Fairfield County. And I love, love, love to work with seniors. I buy a lot of homes from seniors. Oftentimes, seniors up and just want to go, and it's a little it's crazy to try to get rid of 50 years of stuff in your house. And I just say, take what you want. I'll handle the rest. Just take what you want wherever you're going, and don't worry about the rest. We will work on it for you, so you don't have to clear the whole thing out. We also work on your time frame and pay cash. So whatever's easiest for you, whatever's best for you, if you want somebody by your house in a minute or not for 5 months, we just work with you. So also started, because I just love seniors, a senior residential assisted living starting July 1st in Shelton, Connecticut, in the Huntington section. So we don't really have these here, but senior assisted living homes are regular residential homes that somebody is taking care of you or your loved one round the clock. I'm opening a dementia home for seniors, and it is round the clock care for 6 seniors. There are 6 bedrooms, 6 bathrooms, and it's a regular family style living where you have round the clock care and people that come in for entertainment and exercise, and you're eating and dining and being a family unit. So I love the whole concept. It's a beautiful community in a gorgeous house, perfectly brand new in Shelton, acre property, nice backyard. So if you're looking for something serene, affordable, and one-on-one care for your senior, give me a call at 203-689-7562. Today we're going to be talking about if you would like to stay at home, if your senior would like to stay at home and have home health care, when is a good time to bring in a home health care person, what you need to know, how does somebody assess it? So today we have Jennifer Risa. She is a specialist. She is a field supervisor for Fairfield Family Care. And they have more than 100 caretakers that go into the home, and she assesses your needs, where your loved one is at, what they may need, who is the best fit for them, and she is here to tell you all about how that works. Jennifer, welcome to the show. Very happy to have you. And why don't you give us a little bit about your background, Jennifer, and what you do for Fairfield Family Care, and actually how you got into this yourself. I would love to know that.
Okay, so hi, thank you for having me. So my background is nursing. I worked as an LPN in the state of Connecticut for 20 years and loved it. I love taking care of people. I love being there for people. And it got to the point where I had really done everything that there is to do as a licensed practical nurse and wanted to do more. So part of what I did as a nurse was worked in home care.
Mm.
And I was feeling that I was at a point that I wanted to do more of an administrative role. And that's how I pretty much ended up where I'm at now. So I acquired my job with Fairfield Family Care, and I'm the field supervisor. And being the field supervisor, it entails many different facets, and I love what I do. And the primary thing is really, providing care for people.
So you incorporate your nursing and all your knowledge of that with checking out seniors, assessing them, seeing what's best for them, and pairing people with them.
It definitely helps having that, knowledge. Um, After working with many different people of many ages and many different disease processes, uh, predominantly any nurse typically, unless they specialize in a specific area, tend to work with elderly, seniors, geriatric, more than any other uh, population. It's just it happens because they
They're the
talk.
ones that need it the most. Right.
Yes, absolutely.
So tell us a typical, who calls you? So you get a call into the Fairfield Family Care is more than 100 people that go into the home. And I understand half of them do 24/7 care. So how do you pick a person that's going to be just right? Is it based more on personality or based on what the needs are? If somebody has special medical needs or special dementia needs, how are you pairing them up?
Well, we're a
First,
non-medical.
how are you assessing? How are you assessing? Sorry, let's start from the
No,
beginning. I tend to jump, but let's start from the beginning.
no, that's okay. So we're a non-medical home care agency. So basically, a medical home care agency would be like a visiting nurse service. So if someone needed medical home care, that would be that. Being non-medical, we really provide everything else. So we really provide typically what people need most or most of the time. Um, the calls really usually they come in and it's, oh my God, I'm going to lose my mind. I need help. I don't know what to do. And, you know, they vary from there, but family members, they tend to take the brunt of it, especially children. They, I think a lot of it has to do with respect. They don't want to disrespect their parents. Their parents say, oh, I don't need anyone. I don't need anyone, when they do. And so the kids do as much as they can until they're at their wits' end, and they call basically out of desperation.
So, have you seen like a surge with this COVID that people are taking care of their elder? What's happening during this time? Are people wanting to keep their mom and dad home with them, or they're like, oh my gosh, it's like having extra little kids maybe at home, when you're trying to work from home and take care of people. So, what's been happening?
So, that's a very interesting question. It seems like for a second we're starting to slump off. Um, a lot of families were like, oh, we don't want people coming in. We're going to take a little break. Those were the ones that could be present for their family members, or they didn't necessarily need a lot. They only had us coming in maybe a couple of times a week for 4 hours once or twice, and they could go without until the pandemic, started to subside or let up. But then what started to happen was people decided, oh no, I don't want to give up the care for my loved one, but we don't want that foot traffic. So we're going to go from the hourly to a live in, and
Mm,
we just want consistent care. The
yeah,
other thing that happened
and
was,
safe.
yes, exactly. The other thing that happened, teacher, was we started getting calls from the hospital. they had a COVID positive patient that they had to discharge, but still needed help at home. And that was a challenge trying to
Why were
get
they discharging? Why
caregivers
were they discharging them?
because they were flooded. They were
Oh,
flooded and they couldn't keep them. And if they weren't bad enough, if they weren't needing intense medical treatment, having to be on a ventilator or even worse, they had to discharge them because they needed the room for more that were coming in. So they were discharging them, but knowing that they still needed the help, they were calling upon us, asking if we had caregivers that were willing to help. And that was a challenge too.
yeah, because you need to keep your caregiver safe.
Absolutely.
So how did you do that?
Um, Sometimes it took a little bit of begging. I mean,
No, but I mean, how are you really keeping them safe? I know that now they're doing weekly COVID testing, right?
absolutely.
So now they're
So,
doing weekly COVID testing themselves, but do they have all the armor, the mask, the gloves, like everything?
absolutely. So, we obviously we were proactive. We ordered gowns, masks, additional gloves, which we always have on hand. But masks and gowns, because again, we're non-medical, wasn't really something that we would typically
Right.
have to accommodate our clientele. So we were proactive. We got all of that stuff in house. I also got in touch with a local organization called Sew for Connecticut, and they donated 125 hand sewn masks
How
to us for
nice.
our caregivers and clients, which was
That's so nice.
amazing.
Yeah.
And we had all the PPE that we really could accommodate and that really would be required of us on our end to safely send people into a COVID positive situation. Most of the time, either the person was coming out of the hospital after already being tested positive, but past the 14 days, or having received treatment, or again, having been in rehab, tested positive, but either was past that 14-day or received treatment. So, but we still played it safe because you have to.
So are the seniors understanding like people coming in with masks and gloves, or is that kind of scaring them?
A little bit of both. A lot of them understand. A lot of them, you show up and they say, "Oh, take that mask off. You don't need that." I've been in the house for 3 months. So, but they don't, we're doing that to protect them, as well as us. So, yeah, it's been a really trying time. It's been quite a challenge.
Yeah, but now you're seeing a resurge of people wanting home health care, people coming in. I think too that people, even I thought this was going to be like a short-lived thing. I don't know why I wasn't thinking that. But school was canceled for 3 weeks, and you're thinking, oh, 3 or 4 weeks we'll be back to normal. And now
Yeah,
there's no normal anytime soon. So I guess
yeah,
people thought, oh, I could keep my parent at home for a few weeks. Now it's turning into an indefinite situation, and now they know they have to do something. Um,
correct.
so, and a lot of places are not opening up that have really been hit with COVID. These big places, the bigger nursing homes or the bigger assisted livings, they've really gotten, they've had a lot of deaths. And so people are like, I don't want to put my parent there. So even if they have to pay the price, they're willing to take somebody full time in their house. Safer.
It's much safer. We've definitely gotten more calls of people that went into the hospital and legitimately should have gone to rehab, but the family absolutely opposes to it. They would much rather have their parent or loved one um, go home with home care and in home physical therapy. There we go. So put them, rather than put them at risk of, potentially being exposed to COVID. And, I mean, there's no way around it. They've got people on designated wings, but there's no, I don't think, any real way to separate in a place like that. There's just not.
Yeah. So you go in. So typically you go in. People call you, basically like help, SOS. It's like you get an SOS call, like help, help, help. Like I can't do this anymore. My parents beyond what I thought, or they see them for more than everybody looks okay for a few hours, right? But then, like my mother-in-law, I noticed that she wasn't bathing because her bathtub, she only had one bathroom, and her bathtub was filled to the brim with stuff in it. I'm like, pretty sure she's not using the shower.
Yeah.
She had it loaded, and
Yeah.
you know, and I'm like, she is not showering. Like, so you don't really notice those things if you're just visiting, and having some
Right.
tea. But once you're with somebody for a few days, or you can kind of see what's more going on. So I think that's what's going on here. So then you get a big SOS call, like, I need help. You go in and you assess. What happens if you get like a very obstinate senior, or somebody that's just like, I don't need help. I don't want anybody in my house. Or, do you get that?
Oh, yes, I get that every day, or just about. And the unfortunate part is, again, family members, they need to really be stern. They need to put their foot down and say, look, this is the way it's going to be. Um, Either you're going to accept the help, or you can't stay at home anymore. And 99.9% of the time, they want to stay home. They want to stay home. They don't want to go anywhere else. There, on occasion, you'll get that rare occasion where they're like, "Oh no, I can't wait to get out of here," But usually they want to stay home, and so, but they're resistant to the home care, and a lot of times it's because there's already a level of dementia there, and they don't realize, and they think they're all right, and everyone else is crazy. What's wrong with you? I'm fine. And unfortunately, family members will be like, well, we have to honor their wishes, which I get, because, you're respecting your parents, but it shouldn't take a catastrophic event to put into place what they need, because really, truly, you're doing them a disjustice by not making sure they're safe. Start them out slow. They're resistant. Introduce them to one or two caregivers. Have them do it once or twice a week. Let them dip the toes in the pool, so to speak, and get used to it. And then slowly build up, as long as they're at a point where they could do it that way. And that's a good way to start.
Well, also when you see things that are like just safety issues, where they've fallen in the bathroom too often, or they've left the flame on or the gas on, and to point it out, it's like, it's tough. And I think that a lot of kids are not trained, obviously, in dementia. And I know my best friend, her mom, who's 90, wrecked her car 2 years ago. And she kept calling my girlfriend, then didn't, of course, didn't let her have another one, but the mother lives independently 2 hours away. So she kept calling and screaming at her daughter, like, it's my money. I'm going to get a new car. Get me a new car. Give me my money. Let me get a new car. And she was really mad. So my girlfriend had a picture of the car she wrecked on her refrigerator. And she kept saying, Mom, go to your refrigerator. Remember you wrecked the car. Then, when she told me this, I'm like, oh, your mom has dementia. That is not how to handle her. You don't do that to her, because you're bringing her back and upsetting her, right? I'm like, that's not how you handle a dementia person. But who knows? We're lay people, right? So
Yeah.
I'm just like, just say to her, when I come in next, we'll go car shopping. And then you just never did. But you need to calm them, because she kept getting agitated that she didn't have her car, that she wouldn't send her money, that, she kept telling her car was a wreck. She didn't remember wrecking it. And I'm like, oh, so I think so often we as the kids, especially being close, we have no idea. We're not trained nurses. Your parent, you're with them. They seem to be losing it a little. You don't really realize. It's like when your kids are growing and, you don't realize they grew 2 inches this year because you're staring at them all day.
Right.
It's the same idea. So how do we don't know. We're lay people. We don't know what to do with our parents that have early onset of dementia. Sometimes we think, oh, they're just forgetful, like all seniors, but we don't know how bad it is. That's why we need somebody like you to come in, knows the talk. because you do have to talk to them differently. You don't bring them back to reality, right? You meet them where they are. Things like this that people that work with dementia people know, but unless you're reading about it or figuring it out, that's where you come in. So just
So
getting the facts is like, doesn't work.
I recently had a client, and it was interesting because he literally had no idea how bad his mom really was. Like when I first met him, he said 3 months ago, my mom was fine. She was walking, she was outside gardening, she was driving, everything was fine. And the person that I met, there was no way, no way in 3 months' time she got from being
Yeah,
perfect
he
to
didn't
being
recognize.
where she was.
Yeah,
And and I don't think denial is intentional. I think it's a defense mechanism, and it's really difficult, just as it is for a parent to observe a child changing and suffering like that. I think it's difficult for a parent to see a child like that. I think it's the same for a child to see a parent like that. So we kind of like blank out, and we don't pick up on it, or we choose not to subconsciously. And so it does sometimes take
so
someone like me or you.
So, Jennifer, what are some of the tips you could give us as the kids? What, if we're noticing certain things, what should we be like on high alert for?
Well, definitely a change in sleep pattern, a change in eating and drinking habits, um, obviously repeating themselves the same thing in the course of a conversation, repeating themselves, or having a conversation today and then speaking again tomorrow and having no recollection of the conversation we had today. Um, Not taking medication for days on end, important medications that they normally would be spot on about. Um, Little things like that. And sometimes seniors can get a urinary tract infection, and it can literally manifest as like severe, like dementia, or even stroke like symptoms. And it's a urinary tract infection. But you don't really know, and you should never assume. You should always find out what's going on, because even chronic urinary tract infections that keep reoccurring month after month, um, that don't ever really seem to clear up properly, can never really allow that confusion to come back to a normal, uh, you know, baseline for the person. And that could be a long term
And,
problem as well.
and Jennifer, is that caused by lack of bathing or lack of drinking water, or what? Why does somebody keep getting UTIs?
Both. Seniors, just as a general rule, for whatever reason, start to slow down with drinking fluids, primarily water. A lot of seniors don't like water. They grew up in a different time where water just really wasn't important like it is now, or, taught that it's important like it is now. And they don't like to have to pee a lot, because then they have to get up, then they have to walk to the bathroom. And it could be very exhausting for someone that has ambulatory issues, or maybe doesn't necessarily make it to the bathroom. So they're going to decrease their fluid intake. Therefore, they're not flushing out their system the way they should. And the urinary tract infection can hit so fast, so hard and fast.
I was witness to that when my dad was in the hospital a few years ago, and I visited him every single day, and he was fine. Like he was dying of like heart disease, but he was all with it. Um, but I would go there one day and he's totally fine. And the next day he's like hallucinating and seeing things and like picking at himself and thinking somebody's in the room. And then I would like burst into tears crying, like, what happened? And
Yeah.
then like 2 days later, he was back to normal. And they were like, that's a urinary tract infection when you get older. It makes you look like you have dementia. And I was just like, it was scary. So, yeah. Now, when you say eating and drinking habits change, how, like what? Like, how would you notice that? What kind of changes they usually have?
So, so maybe they would normally eat like a healthy, full, normal meal, and now all of a sudden they only want Ensure. Like they'll only drink Ensure. They won't eat like a solid meal, like not even a peanut butter and jelly sandwich.
What is that a sign of?
Well, sometimes they call that failure to thrive. Um, they're it kind of like they're just giving up, you know, and often that's because they're already a little malnourished. They're already dehydrated, and so their body is already feeling like it's shutting down. They don't feel themselves, so they, because they're elderly, so they think, okay, well, this is it, and they're just kind of giving up along with what they think is naturally happening, but it's not. They're just kind of doing it to themselves, and they don't realize.
So you want to make sure eating and drinking. What is another?
Absolutely.
So like if you're just visiting your parents casually, and you're not there for hours on end, and let's say you drop by every 2 weeks and you're, having lunch with them, what, like, are there things to, besides feeding themselves and not really getting things? Are you looking for if they're keeping up their house? Are you looking for if they're,
Finding bruises on them.
oh, bruises?
Yep.
What
Well,
about
see,
just like making sure they're showering and,
well, the problem with showering is a lot of seniors live in a situation where they can't safely get in and out of the shower. So they're not going to really shower. They're just going to kind of do a sponge bath. And so without actually having assistance, they're just not going to do it.
mm,
So that, I mean, as long as they're cleaning themselves, you know, that's okay. Nothing is better than a shower. But the bruises, they could be falling and not really injuring themselves to the point where they can't get up and then not telling you. And that could be happening frequently.
mm-hmm.
And the only way you're going to notice is if you actually see bruises or skin tears or, marks on them. And then you have to ask the question, how did that happen?
So bruises, changing of eating patterns, any kind of disorientation,
Absolutely.
and if you feel like they're not just doing their normal, like washing their clothes or taking care of the house or anything like that, or like you called it failure to thrive, like they're just seem like they're giving up. And when any of those things occur, you should get an assessment. What should you be doing?
Well, I think the first thing you do is call the doctor. They could start slow. Like right now it's difficult. A lot of doctors are starting to see people in the office, but many are still only doing virtual visits. So they may do the virtual visit and then say, okay, I want you to get some blood work,
Mm-hmm.
or I'd like to get a urine sample. And those are things you could do without actually having to go to the office. They're still probably going to need help with that, whether it's getting to the lab for the blood draw and giving the urine sample, or um, just encouragement to do it, really. But the big thing is always call the doctor. You always want to call the doctor, advise them, hey, there's some changes going on, whether they're subtle or big, and address it as soon as possible, because the sooner you do, the quicker you can pick up on something that could be big and you caught it early.
And if you notice your parent is like not cooking for themselves anymore, not taking the medication properly, or sleeping erratically, or wandering, that's when they need help.
Wandering is a big one.
Not just
Um, Maybe they take a walk regularly, and now all of a sudden they took a walk around the neighborhood and couldn't remember which street it was to get back. And, oh, it was just a moment, but that's a big moment. Definitely something to address.
My aunt was driving till she was almost 90, and she had an apartment with my parents' house a few years ago. And she only went like a mile away into town and came back, like every other day. And she came back and she was diagonally across at the neighbor's house who she knew and could not figure out where she lived. And she couldn't remember the neighbor. She couldn't, I mean, you could see the house. Like it was diagonally the house across the street. And she asked if she could get help back to the house. I know. Well, but she was like 91 still driving. So that's kind of when she stopped.
Yeah.
Yeah. Because if you can't figure out you're in front of your own house, that's a problem. Because you could really get lost.
Yeah. Very, very quickly. And, literally, there could be little things happening that you don't pick up on, and they're happening and they don't recognize it because they're confused and they don't know that it's happening. Then all of a sudden something big happens. And regardless, as soon as you detect some kind of difference, some kind of change, even if it just seems like it's forgetfulness, it's not good to just chalk it up and say, oh, well, their age, they're such and such an age, and of course they're forgetful,
Check it
because
out.
it could be a sign of something else.
So Jennifer, this is all good information. Jennifer, so somebody calls you, what kind of things do you need to be told, and who pays you? Is it all self-pay? Does insurance pay for anything? Is it a minimum of hours? Are there overnight people? Like, how does it all work?
So the way we operate, because we're non-medical, we can provide everything from hourly care to round the clock care. So it's all according to the needs of the client. We can do minimum of 4 hours in a day and up to 24/7 round the clock live-in. So we do private pay. Unfortunately, Medicare does not cover the non-medical home care component. Medicaid does cover some, but we do not deal directly with Medicaid, and it's very difficult to find a non-medical home care agency that will accept Medicaid. There are some out there. They're hard to find. We do accept long-term care insurance. Now that is something that is like a life insurance policy that you would have bought into, and then you put in a claim when the time is right, when you think, okay, this is the time we really need help in the house for these things, and you submit a claim, and then they start to reimburse you. And we do work directly with long-term care providers.
So like the Medicaid care that would kick in would be, let's say, like your mom broke her hip and then needs help at home for a few weeks. That's like a medical care that could kick in, but that's
Yeah,
not something that kicks in with non-medical.
so usually that is covered under a Medicare component. Medicaid is really more for people that require state assistance
Okay.
and don't have any other means of financial support for their either medical or non-medical needs. That's when Medicaid would come in, because that's the government support.
So I know some people that really have been set on keeping their parents at home, and they have taken out like a home equity line of credit on their parents' house to keep them in that house. And I've kind of questioned them personally, because I'm like, wow, it's costing you kind of a fortune, and you have to pay the taxes and the heat and the electric and everything. And then your parent is like by themselves with one person all day long in the house. Can really ring up a bill. And I know like some people like, I promised my father he could stay in his house till he dies. It doesn't always seem to make sense.
I guess to each their own. Some people, I mean, they worked really hard all their life for that house. At some point, sometimes that's the only tangible thing that they have left in life. and really, they feel like they want to die in their home. They want to age in place in their home. And I get that. I do. Um, not everyone is social. Some people
Especially
have
when you
no
get
problem.
older, you might not want to be that social, right? And but that's where you guys come into play.
Yeah. Not to say that you can't be social at home with a caregiver, get out, still get out in the community. Again, things are a little crazy right now. It's kind of difficult to do a lot of
Nobody's
that
going
stuff.
anywhere.
But, eventually I think the senior centers will be able to open back up, parks, the museums, and hopefully we'll get back to some kind of normalcy. But yeah, that's a big thing. People want to stay home. The problem is the ones that are resistant to having the help at home. That's the big battle.
Yeah. Very interesting stuff. Very, what would your parting words like to be to our viewers who are maybe wondering if they should be calling you at this moment in time for their senior?
So I think my parting words would be, if you think at all that you have a parent, an aunt, a husband, a wife, a loved one of any kind that needs some sort of home care support at home, call. And I will let you know what I could do to help, how much help you really need, and help you put a plan together, because the worst thing that you could possibly do is not set it up and wait for something really bad to happen and then have no choice.
I have one last question. Sorry. This just happened to a friend of mine. What if you are a relative to somebody who's single and they have dementia, and who's liable for them if they haven't made you their power of attorney or anything? What can you do in that case? It's just happened to my girlfriend with her friend who was like in his 90s and needed help and resisted it. Like, who then, does somebody step in? Can you know what I'm saying? Like, what happens at that point?
So I recently had this situation. I had someone call me up and they were desperate. It was actually their ex-husband.
Mm-hmm.
And she was one of three ex-wives. And he had dementia. And they did have children together. He also had children with the two other wives. And they had not been together for many, many years. But he had nobody. And somehow, a saint, I would call her, she took him in to her home because she knew he had nobody else. The kids were not in a position to really take him in or help him. And so what I did for her, because she wasn't really in a position financially, because she had no control over his finances or anything, she really didn't even know what he had. I put her in connection with an elder attorney and gave her the contact information. And, hopefully she was able to get, the information that she needed with regards to maybe becoming a medical POA or a medical conservator or whatever, because, there's a good chance he might not have signed off on it. And even though he had a diagnosis, she's in a situation right now where, you know, she took him on, but she really needed help. And that wasn't the kind of help that I could give. I don't know the legal aspects
So
of that.
that's great advice. So if you know somebody who, for instance, even though they were related, not related anymore, or even a child who might not have been named as anything, you could go to an elder care attorney and possibly get named as a medical conservator or some sort of conservator, have somebody be named if they don't have it in a will, and figure out what to do with them and to get them help.
Yeah, and you would rather do that than have the state come in and conserve you. You know what I mean? If you could have someone that is family or even
Right,
very
that
close
loves you,
friends.
that's on your side. Yeah, that's
Absolutely.
looking out for the best. Wow,
Yep.
That's really great advice. That's great advice. Jennifer Risa of Fairfield Family Care. You want to get in touch with Jennifer, 203-295-3477. You're providing an excellent service, and it looks like you love what you do.
I do.
So, it's good to know that. And I see you love seniors, you love what you do, and that just shines through. So thank you so much, Jennifer, for coming on and for all that you do. And I will be talking to you very soon.
Thanks so much for having me. It was great talking to you.
Thank you, Jennifer. Bye-bye now. All right, everybody. Thank you so much for watching another edition of Let's Talk Seniors. We will see you tomorrow night. Tomorrow's Thursday, right? We'll see you tomorrow night at 5 o'clock. Look forward to it. Till then.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who feels not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.